Hello, this is Dr. Mark Hassard, the Relaxed Dentist. I wanted to speak about something today that's extremely popular amongst younger dentists and even older dentists too, and that is the concept of patient education. And I wanted to put a contrary view to what's traditionally out there. The standard view is that patient education is a great thing. We can just never give our patients enough information. We just love to tell them all the technical details of what we're going to do. But my counter view is this. I think that's based on two fallacious assumptions. The first fallacy is that patients want to know all the technical details about what we're going to do. And then the second fallacy is that it's useful. That is, if you can give them enough information, they'll suddenly go, oh, I want that treatment, and proceed and have it done. Now let me give you just a simple analogy. If your car broke down and you took it to a mechanic to be repaired, it turned out it was something with the engine, is the mechanic going to call you into his office and say, now before I repair your car, I just have to teach you how an engine works? You'd sort of look at him like, you've lost your mind, you've gone insane, you know, like I'm not interested in how an engine works. Yet so often dentists do that very same thing. Now what do I mean? Well, let's say a patient needs a root filling on a tooth. I've seen dentists time and time again pull out flip charts, pull out whiteboards and start drawing cross sections of teeth and showing them where the reamer goes and where this goes and what we're going to do in stage 1 and what we're going to do in stage 2. And 15 minutes later, if you just look at the patient, you see they're bored silly, their eyes are sort of glazed over and they're missing the whole thing. So I think dentists grossly overestimate how interested patients are in the technical side of what we do. But even, you might say, well, the car analogy is a silly one, that's not relevant. Well, let me give you another one. If you were going to a plastic surgeon for a procedure, let's say to get something done to your nose, straightened or made bigger or smaller, whatever you're going to do, you want them to sort of show you and tell you, well, this is what you've got now and this is the result I'll produce. And if there's any pros and cons, of course they have to tell you about those. But you don't need to know which bone they're going to move and how they're going to break it, where they're going to shape things and where they're going to put the pins. I mean, all that sort of stuff. You trust that they know that stuff. So that's the first fallacious assumption that dentists make. That patients have this deep psychological need to know the technical details of what you're going to do to them. The next fallacy is that the patients want to know that, and once you give that information to them, they'll all of a sudden go, oh, fantastic, that's the treatment for me, I want it. And I've found, if anything, the opposite. The more technical, the more sort of detailed, the more laboriously you lay things out, the more bored they become, the more frustrated they become, the more analytical they become. And it's actually totally counterproductive giving them all this technical details about what you're going to do. It actually forces them to go in the opposite direction that you think. So really you don't need that. Now let me give you an example from my own experience a little while ago. I went to the optometrist just for a standard eye test, and they had this big fancy machine. I pushed my face up against it and it took pictures of the inside of my eyeball. Great, I thought they're probably checking something or whatever. Anyway, I had to sit there and after that was done for a 15-minute tutorial on the anatomy of the inside of my eyeball. And as I'm getting this tutorial from the optometrist, I thought to myself, if I really wanted to know about the inside of eyeballs, I'd just go on Google. Seriously, I would. I'd just go on Google, look it all up, and I'd be done with it. But I'm not in the least interested about the inside of eyeballs. All I wanted her to say is, everything's fine. And as dentists, we've just got to really cut down the amount of technical detail we give patients. You need to give them certain things for informed consent, but don't think you have to teach them chapter and verse on how you do a crown, how you do a root filling, how you do an implant. It's just irrelevant and it's not useful. It's actually counterproductive. I'm Dr. Mark Hassard, the Relaxed Dentist.